Hello and welcome to the Multicultural Media Online Conference. We are hosted by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we're so pleased that you've joined us here today. Pleased to have joining us today, Dr. Jeremy McAnulty. Again, he is the Executive Director of Health Protection. He'll be providing updates on COVID-19, influenza, and other public health matters. Jeremy, it's nice to see you.
Thanks, Jess.
And we have also joining us, we're so pleased to have New South Wales Health Senior Policy Analyst for the Oral Health Promotion team. She's Lenore Tuckerman. Thank you so much for joining us here today.
It's a pleasure, Jess.
Lenore will be talking to us about the importance of oral health, as well as the services available for multicultural communities. So we're so glad to have this conversation today. Last week was Oral Health Week, and so we thought this would be a perfect time for us to discuss the services available for the communities. But first of all, I would like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and also acknowledge our Aboriginal communities and colleagues who may be joining us in this session today. We also pay respects to elders and community leaders who are represented from multicultural communities who are joining us this afternoon. We would like to do a request, as we've always done, and you've been so good at doing this and keeping your microphones on mute and asking the questions on the chat. We would like your thoughts, especially now on oral health. It's important for us to discuss some things that you've found in your community and some messages that you think would be important for us to hear. So we'll start off. But before we even go into oral health, Lenore, we want to ask Dr. McAnulty, how is COVID-19? How are the numbers? And influenza? We have some friends who even still have influenza happening.
Yeah, well, there's still these germs around, and they'll be around forever, as far as we can tell. And that's because we're in a world where people travel now, and so there's a continual reintroduction and with people traveling. However, the good news is that COVID levels are lower than they have been earlier in the year, but there's still COVID about. And influenza, which had peaked several weeks ago and slowly coming down, seems to be continuing that trajectory, coming down. It picked up a bit after the school holidays, but is now coming down again. But there's still flu around. So it's never too late to get vaccinated against influenza and COVID. And again, strongly recommend that people do, if they haven't been vaccinated, just check online about the recommendations if you're not sure, or with your healthcare provider, and just make sure you and your children are up to date. There are other infections that cause respiratory symptoms, coughing and cold-like symptoms, and that can sometimes be severe also around. So things we call like RSV, which can particularly affect little children and older people. Again, they've been trending down, which is good news. Message is things are looking a bit brighter, but always be careful because there's always germs out there. So those things we always promote, like good hygiene, staying home if you're sick, getting a rat test or seeing your doctor if you're particularly at high risk. Have a plan with your doctor about what you do if you get symptoms and what antivirals you might need to take if you're in a high risk category because you've got underlying disease or you're elderly.
Yes, and Dr. McAnulty, one of the things that some people are reminded of is COVID and influenza have the same symptoms, but it could be worse for both, or just sometimes it's asymptomatic, but just make sure that you're vaccinated as well.
Yeah, that's right. So some people, and people have had multiple episodes of one or the other or both of influenza and COVID and can have different levels of symptoms. What the data shows is that over time, the more vaccines you have and natural infection on top of that can give you what we call a better immunity, and so that protects you. And so over time, hopefully the severity of the illness you get might decline, but that'll vary from person to person. And for influenza and COVID, when new strains emerge, then that can have a different impact on you as well.
Yeah. So it's just better to just also practice those habits that we've learned over time.
Clean, wash your hands on a regular basis, stay at home if you're sick, make sure you're up to date with the vaccines.
And I've noticed that everyone is just so good at cleaning things, their surfaces at work and at home.
Yeah, well, we're an open plan office, and so if you're an open plan office, you're sharing with other people or having lunch, common area, I always wipe down with one of the wipes we have just to make sure it's fair to other people.
That's right. And you're not just thinking of yourself, but other people.
That's right.
Well, thank you so much for that update. And Lenore, it's great to have you here, as mentioned. And last week was Oral Health Week, so you must have been busy with the theme, mind, body, and mouth. It's all connected.
Yeah. I mean, it was a great theme, to be honest, because it really is all connected. I think having a healthy mouth is important on so many different levels. So, I mean, particularly when you think about just even before we get into some of the more chronic diseases, but just things like your emotional state. If you've got a healthy smile, you're going to feel a lot better about yourself. All of those sort of things can make a huge difference. However, this is a nice slide that we've just sort of put up, and it really does talk about how your oral health can affect many, many different parts. And some of these you may not have even thought were issues. So things like type 2 diabetes, certainly it can have adverse pregnancy outcomes if you have severe gum disease, heart diseases, some gut issues, some lung conditions, and even Alzheimer's disease. So yeah, it's quite amazing. And I think when you think about the mouth, it is like the portal to, the rest of your body often. And so inflammation and infection, it makes sense that this would travel through the body.
That's really important because, as you said, if it's connected, and as for people from multicultural backgrounds and people coming from to Australia and coming from refugee backgrounds, sometimes that's the last thing. Health is the last of your priorities, but then oral health is sometimes
right down the bottom.
Right down the bottom.
Yeah.
Have
That's true.
you've had that experience where people have been.
Yeah. And I think there's a lot of reasons why often oral health isn't prioritized. Many of those barriers might be things like, cost, not knowing how to access those type of services, many things along those lines. Yeah. We've also got another slide here. This is basically us talking more about those connections. And what we do know, which is really interesting, is that there is a strong connection between severe gum disease and conditions such as diabetes and heart disease. So it's, again, what we were talking about, that bacteria from both severe gum disease and tooth infections. So you can imagine if you have a severely infected tooth and an abscess, that can spread through the bloodstream and, can build up in arteries and blood vessels. And we also know that it's really important in diabetes now, and it makes controlling diabetes more difficult if you have mouth infections.
And it is one of the most common cancers.
Yes, oral cancer is it's severe, it's a nasty cancer. And it's, again, one of the reasons why we encourage people to get dental checkups, because your dental practitioner won't only be looking for cavities and gum disease, they'll also be checking for oral cancer. And again, if it's like many cancers, if it's caught early enough, you can usually have a better outcome. And
this, like you said, the mouth is the portal, and you use your teeth to use everything. And during COVID, we've been very, very careful with what we put in our mouths because of the bacteria and diseases. And we've seen that, Dr. McAnulty, about how important it is to have those habits. And that's just not because of COVID, but because of the other diseases.
Yeah, look, there's a whole lot of things you put in your mouth which can cause infections. At the moment, in fact, we're seeing an increase in gastroenteritis, which is caused by not mouth infections so much, but can't blame you, but viruses such as norovirus, which is often called winter vomiting disease. And if you've had it, which most people have at some point, you get really suddenly sick with vomiting, and it lasts for a day or two, but you just have to stay in bed because you're so. And if you have got little kids, it often goes through the family, often introduced and associated with childcare and so on. So yes, what we put in our mouths is very important. And so those basic things like washing your hand really thoroughly with soap and running water for 20 seconds is really good for preventing transmission from on your hands of those sort of viruses, but also before you handle food or make food sandwiches for other people, make sure you've got clean hands, because you can transfer things on your hands to food onto other people.
Yeah. And then that could cause the diseases in your mouth as well.
Yeah, I mean, I think that with most of the main dental diseases, I mean, the good news is they're often very, very preventable, which is good. So, I think that, we think of dental diseases and we think of things like dental tooth decay, gum disease, and as we mentioned, oral cancer as well. But certainly tooth decay and gum disease, your basic prevention is so important. And it's not rocket science. It's stuff that you've probably been told since you were a child. And the messages are fairly simple. They're things like, brush your teeth twice a day with a fluoride toothpaste. And fluoride toothpaste is really important to get the fluoride really around your mouth. Things like, what you're eating, obviously. So trying to reduce the amount of sugar that you're eating, because obviously sugar feeds the bacteria that are in your mouth, and that can cause lots of issues. With gum disease, brushing with a soft toothbrush. And one of the other things that I'm always surprised people don't realise is after you brush your teeth, you should spit, and we say spit, don't rinse. And it's amazing how many people, get the big glass of water and do this big swish around after they've brushed their teeth and spit out. And really what you're doing is, if you've been brushing with fluoride toothpaste, you're sort of washing the fluoride away. And we don't want that. We actually want the fluoride to hang around your mouth.
That's amazing.
You're going to change your way.
I never thought, because that's why you think, you don't want the aftertaste, but it's actually just spit, don't rinse.
Yeah, you can just get with your toothbrush, just sort of wipe it under the tap for a bit, and then just really, very, very gentle sort of spit, but don't do the big beaker of water big swish.
But that's a great tip. So don't forget, you heard it here to remember that.
You heard it here first.
But one of the things also, fluoride, you mentioned fluoride. And when I first came here, I heard, fluoride, there's fluoride in Sydney water.
Yes.
So a lot of people boil water from countries where overseas, because there's bacteria in the water, people boil it. And when they come here, they also boil the water, but then they lose the fluoride. Is that correct?
No.
That's what my dentist told me.
Okay.
It's
not usually
so. Lenore, tell us.
I mean, the good thing about it, we're very fortunate that in New South Wales, I think it's 96% of our drinking water is fluoridated, which is fantastic. And we have safe, palatable, great water. So there is no need to boil water. It's just for regular drinking. But the fluoride in the water supply is great, and particularly great for, it's great for everyone, but it's particularly great for children.
And it's a good reason to drink town water rather than bottled water, because bottled water, I don't think it has fluoride.
No. Usually doesn't.
Missing out on that help well-being. And, if kids drink water rather than fruit juice or soda pop drinks, then they're much better for them for many reasons, the fluoride, but also less sugar.
Yeah.
Yes, and that's what the dentist had mentioned before. And then I heard that because a lot of them, the kids are drinking water, not bottled water, they're not getting as much fluoride, not from the toothpaste, but also from the water.
Well, that's right. That's right. So, and also too, there's the expense. I mean, bottled water is not cheap. And when you think drinking from a tap is pretty much cheap. So doesn't really cost anything. So,
and the environment,
there's, it's a lot of wins. So I think that if we can encourage people to drink water, and particularly, cut down, and particularly with children, discourage them for drinking, as I say, sugary, soft drinks, all of that sort of thing. Or even, highly acidic fruit juices as their drink of choice. That would not be a good idea, because, water should be the drink of choice.
Thank you. There's a question here from Sapna Lazarus. And can you comment on autoimmune conditions and oral health, please, Lenore?
Okay. Well, I think, again, it's important to really try and keep your mouth as healthy as possible, particularly if you do have an autoimmune disease. I mean, anything that if you end up with infections in your mouth, that is going to affect the rest of your body. So sometimes you find that there are some autoimmune conditions can actually make your mouth worse, make sensitive, can affect your gums in a way. So sometimes as a dental practitioner, you'd recommend potentially a low flavour, low foaming type of toothpaste. Try and keep one with fluoride in it still. But some toothpaste have a very strong flavour, and sometimes if people have got very sensitive mouths, that can be sort of a bit of an irritant. So you can sort of try and either go to a children's type toothpaste, or there are some other brands which are specifically lower in flavour and not as irritable. But yeah, that would be my main take. Jeremy, would you?
Yeah, no, in some autoimmune diseases sort of dry up your saliva and tears, and so it's important to manage your mouth and talk to your dentist.
And there, some of the symptoms from COVID was that you would have no taste.
Yes.
Still, for some people with infections, you can lose your taste and sense of smell, which normally comes back, but it can be quite distressing when you can't taste food anymore.
And in terms of dental health, you just have to just be clean.
Just be vigilant. And as far as, so brushing your teeth twice a day, morning and night, fluoride toothpaste, spitting, not rinsing, cleaning between your teeth is really important too. And I know that's something, sorry? Flossing, yeah. So either flossing or with little interdental cleaners that have been recommended from your dental practitioner. Once a day, if you can do that, that's great. Even if you do it once every couple of days, it's just important to do it, because when we think often the problems that we have, if we do develop any decay, it's often in between the teeth where you can't see. And so that's why it is really important.
So we mentioned flossing, and we have a few questions. Thank you so much. At what age should we teach children to start flossing their teeth?
Oh, that's a really good question. We normally say it's sort of like when the teeth start coming together. That's sort of the main thing. So often with young children, there's sort of gaps between their teeth. And so if there's gaps between your teeth, you don't need to floss because it's a readily cleanable area. But once the sort of usually the back molars, if they're coming together, if you can, great. There's little floss picks which make it quite easy for like a parent to actually be able to do that. But the main thing is brushing twice a day. Yeah, great if you're thinking about flossing. That's terrific.
We have Udai's question here. She's from Multicultural Health Services, Southeastern Sydney. What general dental services do these communities dental clinics offer to children and pensioners? Does it include gap filling or dental crown? It's commonly asked by community members.
Okay, so I can certainly answer the first part about children is really, really good news, because in New South Wales, all New South Wales public dental services are available to all children living in New South Wales as long as they've got a Medicare card. So you don't have to be on any sort of benefit or pension card or anything like that. If you're a child living in New South Wales and you have a Medicare card, you can access state public dental services, public dental clinics. And the good news for that too is also the waiting lists are normally not particularly long at all. So there's a number which I can put up at the end where people can actually ring that number, and then they'll be directed to a local health district where they can make an appointment. So for kids, that's free. Oh, thank you very much for doing that. That's great. There's also the translating and interpreting services number on that screen as well. And certainly we can work together in the dental clinics for that.
So basically, if you need language support, call 131-450 TIS and then ask to be connected to the New South Wales Public Dental Services.
Perfect. Yes, that's great. So that's for kids. So that's great. The other option is some people are eligible for the Commonwealth Dental Benefits Scheme. And that provides a certain amount of money over a couple of years, which means that if they'd like to access private dentists, they may be able to be subsidised for that. But that's it's not everyone, whereas, say, for public dental services, it is everyone. Yeah. So, yeah.
I think the main concern of some communities would be, where do you go first? How do you find access to what we advise people to go to your GP, find a good GP who speaks your language, but with dental services. It's one of those things where you go, where do I go? Maybe I'll just drink a painkiller, and so the pain will go away. But is that, you wouldn't suggest that at all?
Well, no. I mean, clearly, if you've got severe dental pain, and you know, you can always go to a public hospital as well. I mean, like as far as like facial swelling or anything really severe, please go to a public hospital in the emergency department there. For, as I say, if you can use that number, the public dental services number. For finding like a private dentist, you can contact the New South Wales Australian Dental Association, their website. They will have a list of private dentists as well. But yeah, certainly I can understand in many multicultural communities that maybe it might be difficult to find out that information. So, you know, we can just only promote it as much as we can with New South Wales Health.
And would it still be advisable to contact Health Direct line and to be, you know, to call and if there are any pains and they were feeling, instead of going to the emergency first, call Health Direct and find out if where they should be directed to? Would that be a service that people can contact as well?
I think so. Yeah, I think that would be good.
Health Direct.
Yeah. Yeah.
That number will be available for you. And there is also the TIS 131450 to contact. We mentioned about vulnerable groups.
Yes.
And these are the communities.
Yes. There are many vulnerable groups, and certainly I know that within New South Wales Health, we've had a few projects lately that particularly regarding refugee and asylum seeker groups. And there was a pilot program which was started in 2021, started in some of the regional areas. So I think it was Mid and North Coast, Murrumbidgee and Hunter, New England. And this project is now expanded to Southwestern Sydney and Western Sydney. And what it is for any recently arrived refugee and asylum seeker people, they can have sort of priority access to dental screenings and preventive dental, with also some added sort of technological support in the sense of sort of interpreter services via iPads. And the other thing that we've done, which has been really cool as part of that project, is some trauma-informed care training for the practitioners, particularly for asylum seeker groups. So I think that's been really, really valuable.
And it's good that it's been extended to other health areas.
Yeah. So we hope that will be extended even further. Yeah.
That's great information. Please ask your questions on the chat. It's not every day we get an expert on oral health to speak with us. But one of those questions as well is in terms of how do you make sure that your children are, you know, you mentioned earlier that if you get it right when you're young, then it won't be as expensive or as painful.
Yep. Certainly much, much easier. I think particularly with oral diseases, if we can get it right with the kids, it sets them up for life. Really, you know, the idea of, I was going to sound like a broken record, brushing your teeth twice a day with fluoride toothpaste, drinking lots of water, cleaning between the teeth, soft bristle toothbrush, eating healthy diet, if we can, and regular dental checks. So, I mean, that's really important too. So if you can see a dental practitioner regularly, make sure that there's no issues, get on top of anything which we can see at the beginning. That would be great, because I think once then, after, you know, once young people sort of reach 18 and further on, you know, just by having that really good setup, if you've reached 18 and you don't have a filling in your head, that's fantastic. And you've got a healthy mouth and healthy gums. That's so good, because I know certainly with my era, you know, fillings were the norm. And what it means is they're not a forever cure. They break down. So they might last 10, 15 years, 20 years. And every time you replace it, they get bigger. And so that's where you finally end up, you know, potentially with crowns and all that sort of thing. So if we can keep people, you know, cavity free for as long as possible, that's got to be the best outcome.
We've got more questions coming up.
Oh,
here.
okay.
What are the causes of gum inflammations, in your opinion, and any other tips specifically for gum health?
Yeah, great question. So gum health is really important. I mean, we think of teeth and we think of dental decay, but the supporting structure, the gums that hold the teeth, are equally as important. And often as we get older, that can be an area that can really flare up. So important to use a soft bristle toothbrush. Don't use a hard toothbrush because they're too damaging on the gums. Make sure that you brush where the gum meets the tooth. So that junction, really make sure you get to those areas. So when you're brushing your teeth, you should be brushing your gums and your teeth with a soft toothbrush. If you notice that your gums start bleeding, sometimes when you're brushing and you spit out, there's a bit of blood in you when you spit out, that's not a sign to stop. That's actually a sign to brush more. So find out, have a look in your mouth, find out where that part is bleeding. And again, just, with a soft toothbrush, make sure you're brushing in that area. Now, generally that's gingivitis, what we call gingivitis. Generally that will clear up by itself if you continue brushing those areas in about 10 days or so to 2 weeks. If it doesn't, if it keeps on bleeding, then I would suggest you go and see a dental practitioner. But gum health is super important because the other thing is if it gets really bad, you end up with infection pockets. It can actually affect the bone that supports the tooth, and that can start sort of literally going away. And so you end up with a wobbly tooth and you can end up with tooth loss. So that's not good. Yeah.
Well, there's some more questions here. Does mouthwash kill good bacteria in our mouths?
Mouthwash is a really interesting one. Generally speaking, we would not normally recommend mouthwash. I mean, I think if you're going to use a mouthwash, I would use it possibly at lunchtime or sometime in the middle of the day rather than, wait a while. But you don't normally need it. I mean, usually just toothbrush, toothpaste is all you need. Sometimes you are prescribed a mouthwash by a dental practitioner, and there are some with things like chlorhexidine in them, which will actually kill more germs. You would normally only use those for a certain period of time, maybe 2 weeks. But your everyday mouth rinses, normally, some people love them, and that's fine. But I'd say probably use it. Don't brush your teeth and then rinse with mouthwash because the same thing happens as what I said before. You wash all the fluoride out.
So a question here is, and I'll pass this on to Dr. McAnulty as well. Now, mouthwash, a lot of people use it for their teeth, but also for bad breath.
Yes.
Is that related to your mouth, or is that other health issues that could be causing bad breath?
It could be both. I mean, so it might be, again, sometimes if you haven't flossed for a while and you floss, and if you smell the floss, sometimes it smells pretty bad. And so one of the other things we also recommend is brushing your tongue. So after you've finished brushing your teeth, just give your tongue a bit of a brush because the dormant bacteria on the surface of the tongue can often cause malodor. But sometimes it's actually gastrointestinal issues.
Yeah, exactly what you said.
So that's it. There's a lot more going on sometimes.
Yeah, but you'd think, check out the mouth first and make sure you've got good dental hygiene in the first place. There are other conditions that can affect your breath and the smell.
Thank you. So remember, brush your teeth. Do you recommend electronic brushes, or are they too harsh?
That's a great question too. They've come a long way with electric brushes, toothbrushes. And again, if you get one with a very soft head, some people love them and they clean really, really well. Some people do find them a little bit too harsh. So, again, it's sort of a little bit horses for courses in some ways. If you love them and they're cleaning well, great, keep on using them. Certainly, I've done a lot of work with promoting toothbrushing for people with disabilities, and for a carer, brushing somebody else's teeth, an electric toothbrush is great usually because, it's just so much easier to get in if you're brushing another adult's teeth. And some kids love electric brushes too. So generally speaking, I'd say, yep, they're great.
Fantastic. Here, Sapna also has another question. Are some people more prone to gingivitis than others?
Yeah, there can be some conditions, and some people can be a little bit more prone to gingivitis, but generally we'll try and just do the things that I've recommended, brushing with a soft toothbrush, making sure you brush the gums as well as the teeth. If it doesn't clear up, I would seek advice from a dental practitioner and see what's happening in your mouth, because, you might be a little bit more prone. Yeah.
Okay, well, we'll talk about now things that you put in your mouth. It's about vaping, cigarettes, alcohol. I mean, things that go to your mouth. And what do you suggest in terms of vaping? Could it cause more problems?
Yeah, any sort of smoking is not going to be good for your mouth. So whether that's vaping, whether it's shisha smoking, whether it's tobacco smoking, all of those things will not be good for your mouth. So we would say, don't start. If you start, try and stop. Along with the general health messages as well, that clearly they're not good for you. But so, yes, all of those things. Tobacco chewing in some cultures is something, again, that's really not good, and high correlation to mouth oral cancers with, chewing tobacco. So we would, again, recommend you try and seek advice to, quit. Yeah.
Quit. And for other health issues.
Absolutely. And particularly it's dangerous for children who are attracted often by these bright vaping products, which just become addictive if they've got nicotine in them, which often many times they do. And that, leads to a whole cycle of addiction. And goodness knows what's in the vape that they're getting into their mouth, and that's bad for the mouth, but also for your lungs and everything else. It's just such a bad thing. So, support your children and your families and your friends not to vape.
Yeah, and I think, as you said, if you have those habits early, knowing about what you put in your mouth, in the teeth, taking care of your teeth, that will help.
Yeah, definitely.
And for the good breath too.
Absolutely.
Yes, look, we've run out of time, and it's been a really great discussion, but just wanted to ask again, if you could repeat that information about the fee available service for dental care for children under 18.
Absolutely. So if we can just put that slide up again, that would be great. So yeah, I would absolutely encourage, because I know that often, people say it's so expensive to go to the dentist, and I constantly saying, well, if you go through the public system, and they're terrific. The public dental clinics are great. And so please ring the number. If you need help with translating and interpreting services, please ring that number first, and then get on to the 1-800 number and make an appointment for your child. That would be fantastic. Really, really good. Very important.
I have one question as well. If you go to a dentist, and you've been a dental therapist for many years, if you needed language support with someone who doesn't speak English, would there be available services for them?
Yeah, again, probably through the TIS service.
And the dentist can organize that as well.
Yeah, they should be able to. Yes.
Yes,
That's
great.
Yes, certainly through the public service we'll be able to. Yeah.
Thank you very much. And Jeremy, Dr. McAnulty, thank you so much for joining us today. Was there any last words that you wanted to impart with the community?
Don't smoke, don't vape.
Get vaccinated. We haven't even talked about vaccination. Is there vaccination for dental?
No, there's not. That's why it's so important to do all this stuff.
Yeah. Okay. Well, thank you. Thank you so much, Lenore. Thank you so much, Dr. Jeremy. And thank you so much for joining us. And it's been a really good discussion. Thank you for a great session that's been on the chat. Thank you also for adding your questions to the chat. And you've seen the links to the resources on the chat. We'll be sending through this recording to members of the community. And also this will be available, the recording, on the Multicultural Health Communication Service website. We'll be back in another fortnight with in September for more information on health. If there are other issues that you'd like us to discuss, and any guests that you'd like us to book here on this session, we'll be able to consider them. Thank you so much again. Have a great afternoon. Take care and brush your teeth. Take care.